I'm going to be demonstrating a dry powder inhaler. First of all, verify the physician's order for the dry powder inhaler. It's a controlled medication for asthma. I'll be instructing them how to utilize the device as well as when to take the medication. Go ahead and do hand hygiene, put your gloves on. Knock, knock, knock. Hi, is it okay if I come in?
Yes.
Hi, I'm Andrew with Respiratory Therapy.
Hi. How are you doing?
I'm good. How are you doing?
Bit better.
Yeah. We're going to go over. Now I know that you're already familiar with an MDI device, and those typically are utilized for emergency moments where you're having collapsing airways or constrictive airways from the asthma.
Is that my puffer?
That is your puffer. That is your puffer. And so what we're going to do today is give you. It's a dry powdered inhaler. It's similar, not exactly the same. It's not an aerosolized gas, but it is a controlling medication that you will take continuously, whereas the puffer is something you take when you need it. So this is something you kind of set the schedule and you just take it on your schedule because it's a steroid medication. You want to keep the levels at a certain range for them to be effective. And so, let me go ahead and grab it. All right, start with this. Can I verify your name and date of birth?
Yeah, Kapuja, January 9th, 1990.
Great, thanks so much. Make sure you get the right meds for the right person. And take a quick listen. Go ahead and take a deep breath. And again. Okay. Listen to a couple more spots. Record or write on my little notepad their respiratory rate, beats per minute, SpO2 levels on their monitor, and write down their auscultation. Okay, so what we have here is a dry powder inhaler. The medication that comes with this is a dry powder. Yeah, how's that for tricky? So what you do is you make sure that within this container is a little cartridge. The cartridge spins around as we open it, just to give you access to it. As you actuate each little cartridge, that gets pushed out when you cock it. And so the dry powder falls into the chamber. There's a mouthpiece. Make a good seal around it, just like with your PMDI. You want to keep it either flat or upright. Any other position can allow it to escape. It's just dry little powder. Once it's free from its container, once it's been actuated, then it can fall out due to gravity or wind. You don't want to breathe into it. You puff it right back in your face. So what you do is you get a nice, easy exhale, try to get the air out. You've actuated it, mouth goes on, make a good seal, like a burger. That's how I'm a food person. And then breath out. You can hold for a few seconds. You certainly couldn't hurt in terms of how to deposit medication throughout the lungs. Once completed with that, this is twice a day, so every 12 hours approximately, within reason, you're going to be taking it. So after each use, aside of then closing it once you're done, you want to make sure to rinse your mouth out. The medication deposited within your mouth can lead to some other stuff that's just not good in terms of little infection stuff that can occur. If you have further questions with that, I'm sure the physician would be happy to go into detail, or I can try it myself to explain. But it's just always remember a good mouth rinsing with water is fine. Okay. So why don't I have you open it up?
Okay.
And
so twice a day, you said, right?
Twice a day. So we'll start with.
What's this thing do? You spin it?
Yeah, just turn that around. It clicks into position. Perfect.
Actuate it. You gotta make sure it's
keep it flat. Okay. Yep. And then put your mouth around the end. Exhale beforehand. Sorry. Mouth around the end. And nice strong breath in. Hold. You're good to go. Get you a cup of water. Let you rinse your mouth out after you close it up. Good. Can I go ahead and have you take a deep breath and give me a cough?
Mm-hmm.
Excellent. It sounds a little better. I know these medications aren't immediate, This is why, you know, they have them as a controller. It's the backup, it's the backbone of your treatment.
Okay.
Whereas the other is the in moments of more extreme need. And go ahead and take a quick listen to you again.
Okay.
Nice deep inhalation. Good. Right. Now, the medication comes with a set number. It's per month. You want to always remember to take it as regularly, you know, within 12 hours of each other every day. You don't deviate. It's not an emergency medication. It's a controlling medication.
Okay.
Very different in that regard. Do you have any other questions?
What's this little numbers here?
That'll be the indicator as to where you're at in your medication. And you know, you can always do that. Kind of reference yourself, verify, make sure, you know, a family member didn't actually play with it and potentially lose you a dose.
Yeah.
Keep your eye on that number. It's a good way to verify what's left and where
Yeah.
you should be at in your treatment, just in case you have a busy day and you're like, oh my goodness, I didn't remember. And yeah, you give us a call if you have any questions. If you feel like, oh goodness, I missed something, you know, we'll go from there.
Okay.
And we can instruct you on the best route to take.
Okay.
Great. And I hope you're feeling much better as soon as possible.
Thank you. Appreciate it.
Yeah, you're welcome. Have a great day. Come out. I've already recorded before leaving. Get his heart rate, respiratory rate, SpO2, post-treatment. Did the auscultation. Record both pre and post. Record that he feels comfortable. He didn't have any further questions. The device clearly described that it's a controller and that it's to be taken BID. According to the document, gloves off, wash your hands.